You and your pregnancy at 1 to 3 weeks. Your weeks of pregnancy are dated from the first day of your last period. This means that in the first 2 weeks or so, you aren't actually pregnant, your body is preparing for ovulation, releasing an egg from one of your ovaries, as usual. Your getting pregnant timeline is Day 1, the first day of your period. Day 14, or slightly before or after, depending how long your menstrual cycle is, you ovulate. Within 24 hours of ovulation, the egg is fertilized by sperm if you have had sex in the last few days without using contraception. About 5 to 6 days after ovulation, the fertilized egg burrows into the lining of the womb. This is called implantation. You're now pregnant. You at 1 to 3 weeks. The first thing most women notice is that their period doesn't arrive. The most reliable way of finding out if you're pregnant is to take a pregnancy test. Once you think you could be pregnant, it's important to get in touch with a midwife or doctor to start your pregnancy antenatal care. You can do this by contacting your GP, your local hospital's maternity unit. Early signs of pregnancy. For women who have a regular monthly menstrual cycle, the earliest and most reliable sign of pregnancy is a missed period. Women who are pregnant sometimes have a bleed similar to a very light period, with some spotting or only losing a little blood. This is called implantation bleeding. Some of the other early pregnancy signs and symptoms are listed below. Every woman is different and not all women will notice all of these symptoms. Feeling sick during pregnancy. You may feel sick, nauseous, or be sick, vomit. This is commonly known as morning sickness, but it can happen at any time of the day or night. For most women who have morning sickness, the symptoms start when they're around 4 to 6 weeks pregnant. If you're being sick all the time and cannot keep anything down, see a GP. You may have hyperemesis gravidarum, a serious condition in pregnancy that causes severe vomiting and needs treatment. Feeling tired is common in pregnancy. It's common to feel tired, or even exhausted, during pregnancy, especially during the first 12 weeks or so. Hormonal changes in your body at this time can make you feel tired, sick, emotional and upset. Sore breasts in early pregnancy. Your breasts may become larger and feel tender, just as they might do before your period. They may also tingle. The veins may be more visible, and the nipples may darken and stand out. Peeing more often suggests pregnancy. You may feel the need to pee more often than usual, including during the night. Other signs of pregnancy you may notice are constipation, more vaginal discharge without any soreness or irritation, strange tastes, smells and cravings. During early pregnancy, you may find you no longer like some foods or drinks you used to enjoy. You might notice a strange taste in your mouth, which many women describe as metallic. You crave new foods. You lose interest in certain foods or drinks you used to enjoy, such as tea, coffee, or fatty food. You lose interest in smoking. You have a more sensitive sense of smell than usual, for example, the smell of food or cooking. Things to think about. In the early days and weeks of pregnancy, you may not know if you're pregnant. But you can do the following things. Take a folic acid supplement of 400 micrograms a day while you're trying to get pregnant and until the 12th week of pregnancy. Consider taking a vitamin D supplement of 10 micrograms a day. Avoid some foods to protect against infections. Not smoking is one of the best things you can do for your baby's health. You can get supplements from pharmacies and supermarkets, or your GP may be able to prescribe them for you. If you want to get your vitamin D or folic acid from a multivitamin tablet, make sure the tablet does not contain vitamin A or retinol. You and your baby at 4 weeks pregnant. Your baby at 4 weeks. In weeks 4 to 5 of early pregnancy, the embryo grows and develops within the lining of the womb. The outer cells reach out to form links with the mother's blood supply. The inner cells form into 2, and then later into 3, layers. Each of these layers will grow to be different parts of the baby's body. The inner layer becomes the breathing and digestive systems, including the lungs, stomach, gut and bladder. The middle layer becomes the heart, blood vessels, muscles and bones. The outer layer becomes the brain and nervous system, the eye lenses, tooth enamel, skin and nails. In these early weeks of pregnancy, the embryo is attached to a tiny yolk sac that provides nourishment. A few weeks later, the placenta will be fully formed and take over the transfer of nutrients to the embryo. The embryo is surrounded by fluid inside the amniotic sac. It's the outer layer of this sac that develops into the placenta. Cells from the placenta grow deep into the wall of the womb, establishing a rich blood supply. This ensures the baby receives all the oxygen and nutrients it needs. At 4 weeks. Conception usually takes place about 2 weeks after your last period, around the time you release an egg, ovulate. In the first 4 weeks of pregnancy, you probably will not notice any symptoms. The first thing most women notice is that their period does not arrive, or they may have other signs and symptoms of pregnancy, such as breast tenderness. Most women confirm the pregnancy with a pregnancy test. You can work out the date when your baby is due. This date may be changed when you have an ultrasound scan. You and your baby at 5 weeks pregnant. Your baby at 5 weeks. The baby's nervous system is already developing, and the foundations for its major organs are in place. At this stage, the embryo is around 2 mm long. The heart is forming as a simple tube-like structure. The baby already has some of its own blood vessels and blood begins to circulate. A string of these blood vessels connects the baby and mother, and will become the umbilical cord. At the same time, the embryo's outer layer of cells develops a groove and folds to form a hollow tube called the neural tube. This will become the baby's brain and spinal cord. Defects in one end, the tail end, of the neural tube lead to spina bifida. Defects in the head end lead to anencephaly, when the bones of the skull do not form properly. Folic acid prevents spina bifida. You should start taking it as soon as you find out you're pregnant, even before you get pregnant, if possible. At 5 weeks. This is the time of the first missed period, when most women are only just beginning to think they may be pregnant. Things to think about. You're advised to take 400 micrograms of folic acid a day while you're trying to get pregnant and until the 12th week of pregnancy. Not smoking is one of the best things you can do for your baby's health. Avoid some foods in pregnancy to protect against infections. You can save a to-do list to keep track of things to do, such as taking folic acid and getting free dental care. Talk to your midwife, doctor or pharmacist before taking any medicines you buy from a pharmacy when you're pregnant, or any herbal or homeopathic remedies. You and your baby at 6 weeks pregnant. Your baby at 6 weeks. By the time you're 6 to 7 weeks pregnant, there's a large bulge where the heart is and a bump at the head end of the neural tube. This bump will become the brain and head. The embryo is curved and has a tail, and looks a bit like a small tadpole. The heart can sometimes be seen beating on a vaginal ultrasound scan at this stage. The developing arms and legs become visible as small swellings, limb buds. Little dimples on the side of the head will become the ears, and there are thickenings where the eyes will be. By now, the embryo is covered with a thin layer of see-through skin. At 6 weeks. It's normal to feel a range of emotions in pregnancy, and everyone's experience is different. A healthy diet in pregnancy, having foods that are nutritious and safe to eat, is important for the well-being of you and your baby. Stopping smoking when you're pregnant is one of the most important things you can do for your baby's well-being. Ask your midwife, GP or pharmacist for advice and the details of your nearest NHS stop smoking service. You and your baby at 7 weeks pregnant. Your baby at 7 weeks. By 7 weeks, the embryo has grown to about 10 mm long from head to bottom. This measurement is called the crown rump length. The brain is growing rapidly, and this results in the head growing faster than the rest of the body. The embryo has a large forehead, and the eyes and ears continue to develop. The inner ears start to develop, but the outer ears on the sides of the head will not appear for a couple more weeks. The limb buds start to form cartilage, which will develop into the bones of the legs and arms. The arm buds get longer and the ends flatten out. These will become the hands. Nerve cells continue to multiply and develop as the brain and spinal cord, the nervous system, starts to take shape. You at 7 weeks. Your womb has grown to the size of a lemon by the time you're around 7 or 8 weeks pregnant. You're probably feeling tired. Your breasts might feel sore and enlarged, and you may need to pee more often than usual. Some pregnant women start to feel sick or tired, or have other minor pregnancy problems for a few weeks around this time. For most women, feelings of nausea and vomiting, morning sickness, start to improve by the time they're around 14 weeks pregnant. Some infections can harm a pregnancy. It's important to let your doctor or midwife know if you think you may have an infection so they can give you the right care as early as possible. You may have bleeding or sore gums when you're pregnant. Good mouth hygiene and regular dental care, free to pregnant women, to keep your teeth and gums as healthy as possible is the best way to avoid or care for gum problems. You and your baby at 8 weeks pregnant. Your baby at 8 weeks. By the time you're 8 weeks pregnant, the baby is called a fetus, which means offspring. The legs are getting longer. The different parts of the leg are not properly distinct yet. It'll be a bit longer before the knees, ankles, thighs and toes develop. The fetus is still inside its amniotic sac and the placenta is continuing to develop, forming structures that help attach the placenta to the wall of the womb. At this stage, the fetus still gets its nourishment from the yolk sac. You at 8 weeks. Your womb has grown to the size of a lemon by the time you're around 7 or 8 weeks pregnant. You're probably feeling tired. Your breasts might feel sore and enlarged, and you're probably needing to pee more often than usual. You'll probably have missed your second period. But some women experience a little bleeding in pregnancy. Always mention any bleeding in pregnancy to your midwife or GP, particularly if it continues and you get stomach pain. You and your baby at 9 weeks pregnant. Your baby at 9 weeks. The baby's face is slowly forming. The eyes are bigger and more obvious, and have some color pigment in them. There's a mouth and a tongue with tiny taste buds. The hands and feet are developing. Ridges identify where the fingers and toes will be, although they have not separated out yet. The major internal organs, such as the heart, brain, lungs, kidneys and gut, continue developing. At 9 weeks of pregnancy, the baby has grown to about 22 mm long from head to bottom. You at 9 weeks. During this time your breasts will have got bigger, so consider wearing a supportive bra. You may also find that your emotions vary. You feel happy one moment and sad the next. Do not worry, these feelings are normal and should settle down. It's normal to have more vaginal discharge when you're pregnant. But tell your midwife or GP if the discharge smells unpleasant or strange, you feel itchy or sore, or you have pain when you pee. These could be signs of a vaginal infection and need to be checked. You and your baby at 10 weeks pregnant. Your baby at 10 weeks. The ears are starting to develop on the sides of your baby's head, and the ear canals are forming inside the head. If you could look at your baby's face, you'd be able to see an upper lip and 2 tiny nostrils in the nose. The jawbones are developing and already contain all the future milk teeth. The heart is now fully formed. It beats 180 times a minute, that's 2 to 3 times faster than your own heart. The baby is making small, jerky movements that can be seen on an ultrasound scan. You at 10 weeks. You'll be offered screening to find the baby's chance of having Down syndrome, as part of your maternity care. Pregnant women and their babies are at higher risk from flu, influenza, and whooping cough pertussis. You're advised to have a flu vaccination in pregnancy and whooping cough vaccination in pregnancy to protect you and your baby. Domestic violence during pregnancy puts women and their unborn child in danger of miscarriage, infections and other complications. Abuse often starts in pregnancy, and may be physical, emotional or financial in nature. All pregnant women in the UK are routinely asked if they have experienced domestic violence by their midwife or doctor so they can receive advice and support. You and your baby at 11 weeks pregnant. Your baby at 11 weeks. The baby grows quickly and the placenta is rapidly developing. It'll be fully formed at about 12 weeks. The bones of the face are formed now. The eyelids are closed and will not open for a few months yet. The earbuds developing on the sides of your baby's head look more like ears as they grow. Your baby's head makes up 1/3 of its length, but the body is growing fast, it's straightening, and the fingers and toes are separating. There are fingernails. You at 11 weeks. Headaches in pregnancy can be caused by changes in your body. Find out how to care for headaches yourself and when you should contact your doctor or midwife. Limiting the amount of caffeine you have in pregnancy can reduce the chances of miscarriage and your baby weighing less than normal when they're born. Low birth weight. Things to think about. If you're pregnant and working, find out about your legal rights, including paid time off for antenatal pregnancy care, maternity leave, protection of your health and safety at work, and more. The screening test for Downs, Edwards and Patau syndromes involves a blood test and an ultrasound scan, offered between 10 and 14 weeks of pregnancy. If you choose to have this screening test, it can be done at the same time as the If you choose to have this screening test, it can be done at the same time as the dating scan. You and your baby at 12 weeks pregnant. Your baby at 12 weeks. Just 12 weeks after your last period, the fetus is fully formed. All the organs, muscles, limbs and bones are in place, and the sex organs are well developed. From now on, the baby has to grow and mature. It's too early for you to be able to feel the baby's movements yet, although they'll be moving quite a bit. You at 12 weeks. You might notice you're a bit constipated. Not everyone gets constipation in pregnancy, but it's fairly common and can make you feel uncomfortable. You may feel stomach pain or cramps from time to time. These are usually nothing to worry about, and can be caused by constipation, wind or your ligaments growing as your womb gets bigger. But if you have stomach pain that does not go away, is severe, or you also have bleeding or other symptoms, you need to see your midwife or doctor. Things to think about. Make sure you know all the health things you should know when you're pregnant, such as stopping smoking, avoiding alcohol, getting exercise and eating healthily. You'll be offered an ultrasound dating scan between 8 and 11 weeks to calculate your estimated due date, ED, and find out how many babies you're carrying. All women are offered antenatal screening tests to check if their baby has a higher chance of having a health condition, such as Down syndrome. It's up to you whether to have screening tests or not. Find out what antenatal screening is and what's involved to help you decide what's best for you. Sometimes antenatal screening tests find something to indicate your baby has a higher chance of having a health condition. You'll receive support and advice from your midwife or doctor if this is the case, and they'll discuss your options and next steps with you. You can start thinking about where you'd like to give birth, at home, at a birth center or in hospital. Your options will depend on your circumstances and what's available in your area. You and your baby at 13 weeks pregnant. Your baby at 13 weeks. Your baby weighs around 25 g. Your baby's ovaries or testes are fully developed inside their body, and the genitals are forming outside their body. Where there was a swelling between the legs, there will now be a penis or clitoris growing, although you will not usually be able to find out the sex of your baby at an ultrasound scan at this stage. You at 13 weeks. If you've been feeling sick and tired with morning sickness, you'll probably start to feel better when you're around 13 or 14 weeks pregnant. Some women start to experience an increased sex drive around this time, possibly as a result of pregnancy hormones or increased blood flow to the pelvic area. Some women do not, and this is perfectly normal. Read more about sex in pregnancy. You'll notice a small bump developing as your womb grows and moves upwards. If you've been feeling the urge to pee more often over the last few months, it's because your womb was pressing on your bladder. This should ease off now. See your doctor if you notice any pain when you pee. Urinary tract infections can happen in pregnancy, and it's important to treat them quickly to reduce the risk of kidney infection. Things to think about. Find out about the pregnancy care you can expect if you're having twins. You're advised to have your whooping cough vaccination between 16 and 32 weeks of pregnancy. Find out about gestational diabetes and how you'll be screened for it. If you're pregnant or have children under the age of 4, you may be entitled to vouchers for milk, fruit, vegetables, and formula milk if you receive certain benefits or you're under 18. You and your baby at 14 weeks pregnant. Your baby at 14 weeks. At 14 weeks, the baby is about 85 mm long from head to bottom. Around now, the baby begins to swallow little bits of amniotic fluid, which pass into the stomach. The kidneys start to work and the swallowed fluid passes back into the amniotic fluid as urine. You at 14 weeks. How much weight you put on in pregnancy depends on your weight before you get pregnant. Most women gain between 10 kg and 12.5 kg. But gaining too much or too little may cause health problems for you or your baby. Smoking in pregnancy harms your baby and quitting will benefit you both. You and your baby at 15 weeks pregnant. Your baby at 15 weeks. Around this time, your baby will start to hear. They may hear muted sounds from the outside world and any noises your digestive system makes, as well as the sound of your voice and heart. The eyes also start to become sensitive to light. Even though your baby's eyes are closed, they may register a bright light outside your tummy. You at 15 weeks. It is normal to have more vaginal discharge in pregnancy. It's usually thin, clear or milky white and should not smell unpleasant. If it's smelly, you feel itchy or sore, or have pain when you pee, contact your midwife as these could be signs of an infection. Vaginal discharge in pregnancy, what's normal and what's not. You may have backache in pregnancy as your womb gets heavier and pregnancy hormones affect the ligaments in your body, which can put a strain on your lower back. You and your baby at 16 weeks pregnant. Your baby at 16 weeks. The muscles of the baby's face can now move and the beginnings of facial expressions appear. Your baby cannot control these yet. The nervous system continues to develop, allowing the muscles in your baby's limbs to flex. Around this time, your baby's hands can reach each other, they can form a fist, and hold each other when they touch. You at 16 weeks. Itching in pregnancy can be a sign of the rare liver disorder intrahepatic cholestasis of pregnancy, sometimes called obstetric cholestasis or OC. You and your baby at 17 weeks pregnant. Your baby's development. By the time you're 17 weeks pregnant, your baby is growing quickly and now weighs around 150 g. The face begins to look much more human, and eyebrows and eyelashes are beginning to grow. Your baby's eyes can move now, although the eyelids are still shut, and the mouth can open and close. The lines on the skin of the fingers are now formed, so the baby already has their own individual fingerprints. Fingernails and toenails are growing, and the baby has a firm hand grip. You at 17 weeks. You'll be offered ultrasound scans in pregnancy, including the mid-pregnancy anomaly scan offered between 18 weeks and 21 weeks and 6 days. You might hear some people call this the 20-week scan. When you're pregnant, the safest approach to alcohol in pregnancy is not to drink it at all. Your baby cannot process alcohol as well as you can, and it can seriously affect their development. Bleeding from the vagina may be a sign of serious problems, so seek help if you experience vaginal bleeding in pregnancy. You and your baby at 18 weeks pregnant. Your baby at 18 weeks. The baby moves around quite a bit, and may respond to loud noises from the outside world, such as music. You may not feel these movements yet, especially if this is your first pregnancy. If you do, they'll probably feel like a soft fluttering or rolling sensation. You at 18 weeks. Abdominal or stomach pain in pregnancy is common, and can be caused by constipation, wind, or growing pains, as your ligaments stretch to support your growing bump. But abdominal pain can sometimes be a sign of something serious. Some women also get headaches in pregnancy. Headaches in pregnancy are common, but they could be a sign of something serious if they're severe. Things to think about. Start thinking about making your birth plan. Before taking any medicine when you're pregnant that you can buy at a pharmacy, check with your midwife, GP or pharmacist that it's safe to take in pregnancy. You and your baby at 19 weeks pregnant. Your baby at 19 weeks. Your baby is putting on a bit of weight, but still does not have much fat, so if you could see your baby now, they would look a bit wrinkled. The baby will continue to put on weight for the rest of the pregnancy and will fill out by the last few weeks before birth. You at 19 weeks. You might feel your baby move for the first time when you're around 17 or 18 weeks pregnant. Most first-time mums notice the first movements when they're between 18 and 20 weeks pregnant. At first, you feel a fluttering or bubbling, or a very slight shifting movement. Later on you cannot mistake the movements, and can even see the baby kicking about. Often, you can guess which bump is a hand or a foot. There's no set number of baby movements you should feel. The important thing is to get to know your baby's usual pattern of movements. Once you start to feel your baby's movements, you should feel your baby moving right up until they're born. If you think your baby is moving less than usual, call your midwife or maternity unit straight away, as your baby needs to be checked. Do not use a home handheld scanning device Doppler, as these are not reliable. Even if you hear a heartbeat, it does not mean your baby is well. Hormonal changes in your growing bump can cause pain in your pelvis or hips. Find tips on coping with pelvic pain in pregnancy. You may feel hotter than usual during pregnancy, and this is normal. Find tips on keeping cool. Things to think about. Preeclampsia is a pregnancy condition that can cause problems for you and your baby. Learn the symptoms of preeclampsia to look out for. Preeclampsia rarely happens before the 20th week of pregnancy. Most cases occur after 24 to 26 weeks, and usually towards the end of pregnancy. Although less common, the condition can also develop for the first time in the first 6 weeks after birth. Most people only experience mild symptoms, but it's important to manage the condition in case severe symptoms or complications develop. Generally, the earlier preeclampsia develops, the more severe the condition will be. Early signs and symptoms. Initially, preeclampsia causes high blood pressure, hypertension, protein in urine, proteinuria. You probably won't notice any symptoms of either of these, but your GP or midwife should pick them up during your routine antenatal appointments. High blood pressure affects 10 to 15% of all pregnant women, so this alone doesn't suggest preeclampsia. But if protein in the urine is found at the same time as high blood pressure, it's a good indicator of the condition. Read more about diagnosing preeclampsia. Further symptoms. As preeclampsia progresses, it may cause severe headaches, vision problems, such as blurring or seeing flashing lights, severe heartburn, pain just below the ribs, nausea or vomiting, excessive weight gain caused by fluid retention, feeling very unwell, sudden increase in edema, swelling of the feet, ankles, face and hands. If you notice any symptoms of preeclampsia, get medical advice immediately by calling your GP surgery or NHS 111. Without immediate treatment, preeclampsia may lead to a number of serious complications, including convulsions, eclampsia, HELLP syndrome, a combined liver and blood clotting disorder, stroke. But these complications are rare. Read more about the complications of preeclampsia. Signs in the unborn baby. The main sign of preeclampsia in the unborn baby is slow growth. This is caused by poor blood supply through the placenta to the baby. The growing baby receives less oxygen and fewer nutrients than it should, which can affect development. This is called intrauterine or fetal growth restriction. If your baby is growing more slowly than usual, this will normally be picked up during your antenatal appointments when the midwife or doctor measures you. You and your baby at 20 weeks pregnant. Your baby at 20 weeks. By 20 weeks, your baby's skin is covered in a white, greasy substance called vernix. It's thought this helps protect the skin during the many weeks in the amniotic fluid. You at 20 weeks. At 20 weeks pregnant, you're halfway through your pregnancy. You may develop a dark line down the middle of your tummy. This is normal skin pigmentation as your tummy expands to accommodate your growing bump. Normal hair loss slows down, so your hair may look thicker and shinier. You and your baby at 21 weeks pregnant. Your baby at 21 weeks. By 21 weeks, your baby weighs around 350 g. From about this stage onwards, your baby will weigh more than the placenta, which, until now, was heavier than your baby. The placenta will keep growing throughout pregnancy, but not as fast as your baby. Around this time, the baby becomes covered in a very fine, soft hair called lanugo. The purpose of this is not known, but it's thought it may be to keep the baby at the right temperature. The lanugo usually disappears before birth. You at 21 weeks. Your womb will begin to get bigger more quickly and you'll really begin to look pregnant. You may feel hungrier than before. Try to stick to a balanced, healthy diet in pregnancy, and make sure you know what foods to avoid when you're pregnant. Things to think about. Stopping smoking in pregnancy completely while you're pregnant is one of the most important things you can do for your baby's well-being. Your baby at 22 weeks. Your baby is beginning to get into a pattern of sleeping and waking, which will not necessarily be the same as yours. When you're in bed at night, feeling relaxed and trying to sleep, your baby may be wide awake and moving about. You at 22 weeks. Not everybody gets stretch marks, but if you do, they will probably start becoming noticeable when you're around 22 to 24 weeks pregnant. They may appear on your stomach, breasts and thighs. At first they look red, then fade to a silvery gray. Your breasts may start to leak a little pre-milk. This is normal. You may also notice skin changes in pregnancy. Things to think about. The whooping cough vaccination. What you need to know. 15 weeks before your due date, you need to tell your employer when you'd like to start your maternity leave. Antenatal classes are an important part of preparation for birth. Your baby at 23 weeks. Your baby's lungs are not yet able to work properly, but they are practicing breathing movements to prepare for life outside the uterus. Your baby gets all their oxygen from you via the placenta, and will do so until they're born. You at 23 weeks. Some pregnant women develop piles, hemorrhoids. Piles are swellings containing enlarged blood vessels inside or around your bottom, the rectum and anus. Piles can happen to anyone, pregnant or not, and can be very uncomfortable. Piles can happen to anyone, pregnant or not, and can be very uncomfortable. They can happen when you're pregnant because hormones make your veins relax, but there are ways to ease piles in pregnancy. Tiredness and lack of sleep are common in pregnancy. There are plenty of things you can do to help yourself sleep, including using pillows to support your growing bump. Things to think about. How to write a birth plan. Why breastfeeding is good for you and your baby. Things you'll need for your baby. Your baby at 24 weeks. By the time you're 24 weeks pregnant, the baby has a chance of survival if they are born. Most babies born before this time cannot live because their lungs and other vital organs are not developed enough. The care that can now be given in baby, neonatal, units means more and more babies born early do survive. But for babies born around this time, there are increased risks of disability. You at 24 weeks. Some women get thrush in pregnancy. Having thrush when you're pregnant can be irritating, but it won't harm your baby. Your midwife can recommend treatment. See your doctor or midwife if you have any pain when you pee. This could be sign of a urinary tract infection that needs treating. Things to think about. Where to have your baby, weigh up your choices. Know the signs of premature labor. How to introduce your new baby to their siblings. Premature labor is labor that happens before the 37th week of pregnancy. About 8 out of 100 babies will be born prematurely. Non-urgent advice: call your midwife or maternity unit if you're less than 37 weeks pregnant and you have regular contractions or tightenings. Period type pains. A show, when the plug of mucus that has sealed the cervix during pregnancy comes away and out of the vagina. A gush or trickle of fluid from your vagina, this could be your waters breaking. Backache, that's not usual for you. The midwife or hospital will offer checks, tests and monitoring to find out whether your waters have broken. You're in labor. you have an infection. These may include a vaginal examination, blood test, urine test, and cardiotocography to record contractions and the baby's heartbeat. They'll need to check you and your baby to find out whether you're in labor and discuss your care choices with you. Planned premature labor. In some cases, preterm labor is planned and induced because it's safer for the baby to be born sooner rather than later. This could be because of a health condition in the mother, such as preeclampsia, or in the baby. Your midwife and doctor will discuss with you the benefits and risks of continuing with the pregnancy versus your baby being born premature. You can still make a birth plan and discuss your wishes with your birth partner, midwife, and doctor. If your waters have broken. If your waters have broken, called preterm pre-labor rupture of membranes, PPROM, there's an increased risk of infection for you and your baby. You'll be offered antibiotics to take for a maximum of 10 days, or until labor starts, whichever is sooner. Tests for infection, which may include blood and urine tests. PPROM does not definitely mean you're going into labor. You may be able to go home if there's no infection and you do not go into labor within 48 hours. If you go home, you'll be advised to tell your midwife immediately if your temperature is raised. A raised temperature is usually over 37.5 C, but check with your midwife, they may need you to call before it gets to 37.5 C. You should take your temperature every 4 hours when you're awake. Any fluid coming from your vagina, called vaginal loss, is colored or smelly. You bleed from your vagina. Your baby's movements slow down or stop. If your preterm labor is planned or unplanned, or if your waters have broken prematurely, you may be offered steroid injections. If your waters have not broken, your midwife or doctor should discuss with you the symptoms of preterm labor and offer checks to see if you're in labor. These checks can include asking you about your medical and pregnancy history, and about possible labor signs, such as contractions, how long, how strong, and how far apart they are. Any pain. Vaginal loss, such as waters or a show. You may be offered a vaginal examination, and your pulse, blood pressure, and temperature may also be checked. Your midwife or doctor will also check your baby. They'll probably feel your bump to find out the baby's position and how far into your pelvis the baby's head is. They should also ask about your baby's movements in the last 24 hours. If they do not ask, tell them about the baby's movements. If you're in premature labor, the midwife or doctor may offer medicine to try to slow down or stop your labor, tocolysis. Steroid injections, which can help your baby's lungs. Slowing down labor or stopping it is not appropriate in all circumstances. Your midwife or doctor can discuss your situation with you. They will consider how many weeks pregnant you are, whether it might be safer for the baby to be born, for example, if you have an infection or you're bleeding, local neonatal, newborn care facilities, and whether you might need to be moved to another hospital. Your wishes. Steroid injections can help your baby's lungs get ready for breathing if they're born prematurely. There are 2 injections, given 12 hours apart. Your midwife or doctor will discuss the benefits and risks with you. Steroids probably will not be offered after 36 weeks, as your baby's lungs are likely to be ready for breathing on their own. If you're in premature labor and you're 24 to 29 weeks pregnant, you should be offered magnesium sulfate. This can help protect your baby's brain development. You may also be offered it if you're in labor and 30 to 33 weeks pregnant. This is to protect your baby against problems linked to being born too soon, such as cerebral palsy. If you take magnesium sulfate for more than 5 to 7 days or several times during your pregnancy, your newborn baby may be offered extra checks. This is because prolonged use of magnesium sulfate in pregnancy has in rare cases been linked to bone problems in newborn babies. You may be offered treatment to prevent early labor if you've given birth at less than 34 weeks pregnant before. You've had a miscarriage from 16 weeks pregnant before. Your waters have broken before 37 weeks, in this pregnancy or before. Your cervix has been injured in the past, for example through surgery. Your cervix is shorter than expected. This is usually measured with a scan in your vagina. There are two treatments. A small tablet of hormone medicine that you put into your vagina. This treatment usually starts between 16 and 24 weeks of pregnancy and continues until at least 34 weeks. An operation to put a stitch in your cervix to help support it. Your midwife or doctor will offer the choice of two treatments and they should discuss the risks and benefits with you. What are the risks to my baby of being born early? Babies born before full term, before 37 weeks, are vulnerable to problems associated with being born premature. The earlier in the pregnancy a baby is born, the more vulnerable they are. Babies are considered viable at around 24 weeks of pregnancy. This means it's possible for them to survive being born at this stage. Babies born this early need special care in a hospital with specialist facilities for premature babies. This is called a neonatal unit. They may have health and development problems because they have not fully developed in the womb. If your baby is likely to be delivered early, you should be admitted to a hospital with a neonatal unit. Not all hospitals have facilities for the care of very premature babies, so it may be necessary to transfer you and your baby to another unit, ideally before delivery, if time permits, or immediately afterwards. Twins and multiples. Twins and triplets are often born prematurely. The average delivery date for twins is 37 weeks, and 33 weeks for triplets. If you have any reason to think that your labor may be starting early, contact your hospital straight away. Your baby at 25 weeks. The baby is moving about a lot, and responds to touch and sound. A very loud noise may make them jump and kick, and you'll be able to feel this. Your baby is regularly passing urine into the amniotic fluid. Sometimes the baby may get hiccups and you can feel the jerk of each hiccup. You at 25 weeks. You may have some swelling in your face, hands or feet. This might be caused by water retention, which is normal. Try resting and lifting up your swollen feet to ease it. Be sure to mention any swelling to your midwife or GP so they can take your blood pressure and rule out a condition called preeclampsia, which can cause swelling. Other symptoms of preeclampsia include severe headache, vision problems such as blurring or flashing lights, and pain under the ribs. It's common to get backache in pregnancy as your bump grows and your body prepares for labor and birth. Things to think about. Are you drinking too much coffee? See how much caffeine you can safely have in pregnancy. If you're taking maternity leave from work, you need to tell your employer in writing at least 15 weeks before your baby is due. This is when you're 25 weeks pregnant. Your baby at 26 weeks. The baby's eyelids open for the first time around now and they will soon start blinking. It's not until some weeks after the birth that your baby's eyes become the color they will stay. You at 26 weeks. Pregnancy and birth can weaken the muscles of the pelvic floor and you may notice you leak pee when you cough, sneeze or strain your stomach muscles. Your pelvic floor is made up of layers of muscles inside your body that stretch like a hammock from the pubic bone in front to the end of the backbone. Pelvic floor exercises can help strengthen the muscles so they work better. Things to think about at 26 weeks. Pregnant women in England are advised to have the whooping cough vaccination between 16 and 32 weeks of pregnancy. Ask your midwife or GP if you have not had yours yet. Massaging your perineum, the area between your vagina and anus, from 35 weeks of pregnancy can reduce the chance of tearing, needing a cut, episiotomy, and postnatal perineal pain in women having their first vaginal birth. Varicose veins are common in pregnancy. How to ease the pain of varicose veins. Varicose veins in pregnancy. Varicose veins are veins that have become swollen. They can be uncomfortable but aren't harmful. They most commonly affect leg veins. You can also get varicose veins in the vaginal opening, vulva, although these usually get better after the birth. If you have varicose veins, you should avoid standing for long periods of time. Try not to sit with your legs crossed. Try not to put on too much weight, as this increases the pressure. Sit with your legs up as often as you can to ease the discomfort. Try compression tights, which you can buy at most pharmacies. They won't prevent varicose veins but can ease the symptoms. Try sleeping with your legs higher than the rest of your body, use pillows under your ankles or put books under the foot of your bed. Do foot and other antenatal exercises, such as walking and swimming, which will help your circulation. Try these foot exercises. Bend and stretch your foot up and down 30 times. Rotate your foot 8 times one way and 8 times the other. Repeat with the other foot. Your baby at 27 weeks. By now your baby's heart rate will have slowed to around 140 beats per minute. This is still considerably faster than your own heart rate. Your baby's brain, lungs and digestive system are formed but not fully mature, and are still developing. You at 27 weeks. Nosebleeds are quite common in pregnancy because of hormonal changes. Often there's nothing to worry about, and they usually stop with a nosebleed treatment you can do yourself. Not everyone gets stretch marks. If you do, they may appear on your tummy, thighs or breasts. Stretch marks are not harmful and there's no treatment for them, but they usually fade with time. Your baby at 28 weeks. By 28 weeks, your baby weighs around 1 kg and is perfectly formed. The baby's heartbeat can now be heard through a stethoscope. Your partner may even be able to hear it by putting an ear to your bump, but it can be difficult to find the right place. Your baby keeps putting on weight, as more and more fat appears under the skin. You at 28 weeks. At your 28-week antenatal appointment, your midwife or doctor will measure your blood pressure, test your urine for protein, discuss the results of any screening tests from your last appointment. Heartburn or acid reflux is common in pregnancy. It can be uncomfortable but isn't harmful. Find out how to avoid heartburn and how to ease the symptoms. If you've been told your blood type is rhesus negative, you'll be offered an injection in pregnancy to protect your unborn baby. You'll be offered tests for your blood and your baby's blood at birth, and you may be offered a second injection to protect your babies in any future pregnancies. Things to think about. The stages of labor and signs labor has started. Exercise is good for you and your baby at any stage of pregnancy. Your baby at 29 weeks. Your baby continues to be very active at this stage, and you'll probably be aware of lots of movements. There's no set number of baby movements you should feel each day, every pregnancy is different. You should be aware of your baby's own pattern of movements. If this pattern changes, contact your midwife or hospital to tell them. You at 29 weeks. As your bump pushes up against your lungs and you have extra weight to carry around, you may feel breathless. Swollen ankles are common in pregnancy. It's normal to get some swelling in pregnancy, particularly in your legs, ankles, feet and fingers. It's often worse at the end of the day and further into your pregnancy. Swelling that comes on gradually isn't usually harmful to you or your baby, but it can be uncomfortable. A sudden increase in swelling can be a sign of preeclampsia, a condition that affects some pregnant women, usually during the second half of pregnancy, from around 20 weeks, or soon after the birth. Non-urgent advice: call your midwife, GP or labor ward immediately if you have a sudden increase in swelling in your face, hands or feet. A very bad headache. Problems with your vision, such as blurring or flashing lights in your eyes. Severe pain just below your ribs. Vomiting with any of these symptoms. These could be symptoms of preeclampsia, which can lead to serious complications if it's not monitored and treated. Normal pregnancy swelling. Swelling is caused by your body holding more water than usual when you're pregnant. Throughout the day, the extra water tends to gather in the lowest parts of the body, especially if the weather is hot or you have been standing a lot. The pressure of your growing womb can also affect the blood flow in your legs. This can cause fluid to build up in your legs, ankles and feet. Things you can do to avoid and ease swelling. Try to avoid standing for long periods. Wear comfortable shoes and socks, avoid tight straps or anything that might pinch if your feet swell. Try to rest with your feet up as much as you can. Drink plenty of water, this helps your body get rid of excess water. Exercise, try to take regular walks during the day or doing foot exercises. Foot exercises. You can do foot exercises sitting or standing. They improve blood circulation, reduce swelling in the ankles, and prevent cramp in the calf muscles. Bend and stretch your foot up and down 30 times. Rotate each foot in a circle 8 times one way and 8 times the other way. Your baby at 30 weeks. The sucking reflex is developing by now and your baby can suck its thumb or fingers. The baby is growing plumper, and the skin begins to look less wrinkled and much smoother. The white, greasy vernix and the soft, furry, fine hair, lanugo, that have covered your baby's skin for some time begin to disappear. You at 30 weeks. Leg cramps at night are common at around 29 to 32 weeks. There are things you can do to avoid an ease cramp. You may find it hard to sleep because you cannot get comfortable. Try lying curled up on your side with a pillow between your legs and a cushion under your bump. You might also find you need to pee a lot. Itching is common in pregnancy and often gets better with self-care, but sometimes it can be a symptom of a liver condition called intrahepatic cholestasis of pregnancy, ICP, also known as obstetric cholestasis, OC. Your baby at 31 weeks. Your baby's eyes can focus now. The lungs are developing rapidly, but your baby would not be fully able to breathe on their own until about 36 weeks. You at 31 weeks. Your midwife and doctors will offer to check your blood pressure at every appointment. This is because high blood pressure can be harmful for women and their babies, and can be an early sign of preeclampsia. Other signs of preeclampsia include bad headache, vision problems and pain below your ribs. Knowing what to expect in the first few days of breastfeeding your baby can help to get breastfeeding off to a good start. Your baby at 32 weeks. By about 32 weeks, the baby is usually lying with their head pointing downwards, ready for birth. This is known as cephalic presentation. If your baby is not lying head down at this stage, it's not a cause for concern. There's still time for them to turn. The amount of amniotic fluid in your uterus is increasing, and your baby is still swallowing fluid and passing it out as urine. You at 32 weeks. Being active and fit during pregnancy will help you adapt to your changing shape and weight gain. It can also help you cope with labor and get back into shape after the birth. Exercise tips for pregnancy. Do not exhaust yourself. You may need to slow down as your pregnancy progresses or if your maternity team advises you to. If in doubt, consult your maternity team. As a general rule, you should be able to hold a conversation as you exercise when pregnant. If you become breathless as you talk, then you're probably exercising too strenuously. If you were not active before you got pregnant, do not suddenly take up strenuous exercise. If you start an aerobic exercise program, such as running, swimming, cycling or aerobics classes, tell the instructor that you're pregnant and begin with no more than 15 minutes of continuous exercise 3 times a week. Increase this gradually to daily 30-minute sessions. Remember that exercise does not have to be strenuous to be beneficial. Exercise tips when you're pregnant. Always warm up before exercising, and cool down afterwards. Try to keep active on a daily basis. 30 minutes of walking each day can be enough, but if you cannot manage that, any amount is better than nothing. Avoid any strenuous exercise in hot weather. Drink plenty of water and other fluids. If you go to exercise classes, make sure your teacher is properly qualified and knows that you're pregnant, as well as how many weeks pregnant you are. You might like to try swimming because the water will support your increased weight. Some local swimming pools provide aquanatal classes with qualified instructors. Find your local swimming pool. Exercises that have a risk of falling, such as horse riding, downhill skiing, ice hockey, gymnastics and cycling, should only be done with caution. Falls carry a risk of damage to your baby. Exercises to avoid in pregnancy. Do not lie flat on your back for long periods, particularly after 16 weeks, because the weight of your bump presses on the main blood vessel bringing blood back to your heart, and this can make you feel faint. Do not take part in contact sports where there's a risk of being hit, such as kickboxing, judo or squash. Do not go scuba diving, because the baby has no protection against decompression sickness and gas embolism, gas bubbles in the bloodstream. Do not exercise at heights over 2,500 m above sea level. This is because you and your baby are at risk of altitude sickness. Exercises for a fitter pregnancy. If you are pregnant, try to fit the exercises listed in this section into your daily routine. These types of exercise will strengthen your muscles to help you carry the extra weight of pregnancy. They'll also make your joints stronger, improve circulation, ease backache, and generally help you feel well. Stomach strengthening exercises. As your baby gets bigger, you may find that the hollow in your lower back increases, and this can give you backache. These exercises strengthen stomach, abdominal muscles and may ease backache, which can be a problem in pregnancy. Start in a box position, on all fours, with knees under hips, hands under shoulders, with fingers facing forward and abdominals lifted to keep your back straight. Pull in your stomach muscles and raise your back up towards the ceiling, curling your trunk and allowing your head to relax gently forward. Do not let your elbows lock. Hold for a few seconds, then slowly return to the box position. Take care not to hollow your back. It should always return to a straight, neutral position. Do this slowly and rhythmically 10 times, making your muscles work hard and moving your back carefully. Only move your back as far as you can comfortably. Pelvic tilt exercises. Stand with your shoulders and bottom against a wall. Keep your knees soft. Pull your tummy button towards your spine, so that your back flattens against the wall. Hold for 4 seconds, then release. Repeat up to 10 times. Pelvic floor exercises. Pelvic floor exercises help to strengthen the muscles of the pelvic floor, which come under great strain in pregnancy and childbirth. The pelvic floor consists of layers of muscles that stretch like a supportive hammock from the pubic bone in front to the end of the backbone, spine. If your pelvic floor muscles are weak, you may find that you leak urine when you cough, sneeze or strain. This is quite common, and there is no reason to feel embarrassed. It's known as stress incontinence, and it can continue after pregnancy. You can strengthen these muscles by doing pelvic floor exercises. This helps to reduce or avoid stress incontinence after pregnancy. All pregnant women should do pelvic floor exercises, even if you're young and not suffering from stress incontinence now. How to do pelvic floor exercises. Close up your bottom, as if you're trying to stop yourself going to the toilet. At the same time, draw in your vagina as if you're gripping a tampon, and your urethra as if to stop the flow of urine. At first, do this exercise quickly, tightening and releasing the muscles immediately. Then do it slowly, holding the contractions for as long as you can before you relax. Try to count to 10. Try to do 3 sets of 8 squeezes every day. To help you remember, you could do a set at each meal. As well as these exercises, practice tightening the pelvic floor muscles before and during coughing and sneezing. Some women develop pelvic pain in pregnancy. This is not harmful to your baby, but it can cause severe pain and make it difficult for you to get around. Find out about ways to tackle pelvic pain in pregnancy. Breastfeeding has long-term benefits for you and your baby. It's never too early to start thinking about how you're going to feed your baby, and you do not have to make up your mind until your baby is born. Your baby at 33 weeks. By 33 weeks of pregnancy, the baby's brain and nervous system are fully developed. You at 33 weeks. Too much caffeine in pregnancy can cause miscarriage or for your baby to be born with a low birth weight. If you're pregnant, don't have more than 200 milligrams, 200 mg, of caffeine a day. That's about the same as 2 mugs of tea, plus 1 can of cola. Heartburn or acid reflux in pregnancy is common, caused by hormonal changes and the growing baby pressing against your stomach. Symptoms of indigestion and heartburn. Symptoms of indigestion and heartburn include a burning sensation or pain in the chest, feeling full, heavy or bloated, burping or belching, feeling or being sick, bringing up food. Symptoms usually come on soon after eating or drinking, but there can sometimes be a delay between eating and developing indigestion. You can get symptoms at any point during your pregnancy, but they are more common from 27 weeks onwards. Things you can do to help with indigestion and heartburn. Changes to your diet and lifestyle may be enough to control your symptoms, particularly if they are mild. Eat healthily. You're more likely to get indigestion if you're very full. If you're pregnant, it may be tempting to eat more than you would normally, but this may not be good for you or your baby. Find out more about a healthy diet in pregnancy and foods to avoid. Change your eating and drinking habits. You may be able to control your indigestion with changes to your eating habits. It can help to eat small meals often, rather than larger meals 3 times a day, and to not eat within 3 hours of going to bed at night. Cutting down on drinks containing caffeine, and foods that are rich, spicy or fatty, can also ease symptoms. Keep upright. Sit up straight when you eat. This will take the pressure off your stomach. Propping your head and shoulders up when you go to bed can stop stomach acid coming up while you sleep. Stop smoking. Smoking when pregnant can cause indigestion, and can seriously affect the health of you and your unborn baby. When you smoke, the chemicals you inhale can contribute to your indigestion. These chemicals can cause the ring of muscle at the lower end of your gullet to relax, which allows stomach acid to come back up more easily. This is known as acid reflux. Smoking also increases the risk of your baby being born prematurely, before week 37 of your pregnancy. Your baby being born with a low birth weight. Sudden infant death syndrome, SIDS, or cot death. Avoid alcohol. Drinking alcohol can cause indigestion. During pregnancy, it can also lead to long-term harm to the baby. The chief medical officers of the UK say it's safest to not drink alcohol at all in pregnancy. When to get medical help. See your midwife or GP if you need help managing your symptoms or if changes to your diet and lifestyle don't work. They may recommend medicine to ease your symptoms. You should also see your midwife or GP if you have any of the following: difficulty eating or keeping food down, weight loss, stomach pains. Your midwife or GP may ask about your symptoms and examine you by pressing gently on different areas of your chest and stomach to see whether this is painful. Changes to your diet and lifestyle may be enough to control your symptoms. If not, your midwife or GP can recommend treatment. Your placenta grows in your womb during pregnancy. It brings oxygen and nutrients to your growing baby and takes waste products out of your baby's blood. Your baby at 34 weeks. Your baby's bones are continuing to harden, apart from the skull bones. These will stay soft and separated until after the birth to make the journey through the birth canal easier. The bones can move gently and slide over each other so the head can be born safely while still protecting the brain. You at 34 weeks. Preeclampsia is a condition that affects some women in pregnancy, usually after 20 weeks, and it can be serious. The blood pressure and urine checks you're offered at your midwife appointments check for the early signs. Know the other signs of preeclampsia to look out for, including a bad headache, swelling and vision problems. Gas and air, Internox, is a form of pain relief you can be offered in labor, including at a home birth. Your baby at 35 weeks. Your baby is curled up in the uterus now, with legs bent up towards their chest. There's little room to move about, but he or she will still change position, so you'll still feel movements and be able to see them on the surface of your bump. If your baby is a boy, his testicles are beginning to descend from his abdomen into his scrotum. You at 35 weeks. Labor that starts before 37 weeks is considered premature. If your baby is born early, he or she may need special care in hospital. You'll probably find you need to slow down because the extra weight makes you tired, and you may get backache. You should still be feeling your baby move right up until they're born. If you notice any change in your baby's movements, call your midwife straight away so your baby can be checked. Do not use a home handheld device Doppler to check your baby. These are not reliable, and even if you hear a heartbeat, this does not guarantee your baby is well. Your baby at 36 weeks. By 36 weeks, your baby's lungs are fully formed and ready to take their first breath after the birth. The digestive system is fully developed and your baby will be able to feed if they're born now. You at 36 weeks. From around now, you may be aware of a tightening feeling in your lower tummy from time to time. These are a normal part of pregnancy, known as Braxton Hicks contractions. Your uterus is practicing for the tightenings or contractions of labor. Find out about signs labor may have started and what happens. When contractions become longer, stronger, and more frequent, it can be a sign that labor is starting. Information. Call your midwife or hospital when your contractions are in a regular pattern, coming every 5 minutes and lasting at least 60 seconds. It can help to keep a record of how long your contractions are and when they come, so you can tell your midwife when you call. Things to think about. Packing your bag ready for the birth if you're planning to give birth in hospital or a midwifery unit. Having all your important phone numbers handy, your midwife, hospital, any family and friends, in case labor starts. If you have children already, making childcare arrangements for when you go into labor. Your pain relief options, including things you can do yourself. Your baby at 37 weeks. At 37 weeks, your pregnancy is considered full term. The average baby weighs around 3–4 kg by now. Your baby is ready to be born, and you'll be meeting him sometime in the next few weeks. Your baby's gut digestive system now contains meconium, the sticky green substance that will form your baby's first poo after birth. It may include bits of the lanugo, fine hair, that covered your baby earlier in pregnancy. You at 37 weeks. When you're around 37 weeks pregnant, if it's your first pregnancy, your baby moves down ready to be born. You may feel more comfortable when this happens, and you'll probably also feel increased pressure in your lower abdomen. If it's not your first pregnancy, the baby may not move down until labor. You may notice your breasts leaking some fluid, and this is normal. Your baby at 38 weeks. If your baby does a poo during labor, which can sometimes happen, the amniotic fluid will contain meconium. If this is the case, your midwife will want to monitor your baby closely as it could mean he or she is stressed. You at 38 weeks. Most women go into labor between 38 and 42 weeks of pregnancy. Your midwife or doctor should give you information about what to expect if your baby is overdue. Your baby at 39 weeks. In the last weeks, sometime before birth, the baby's head should move down into your pelvis. When your baby's head moves down like this, it's said to be engaged. When this happens, you may notice your bump seems to move down a little. Sometimes the head does not engage until labor starts. You at 39 weeks. Preeclampsia is a serious pregnancy-related condition. Not everyone with preeclampsia has symptoms, but the urine and blood pressure tests at your antenatal visits check for it. Symptoms can include severe headaches, vision problems, such as blurring or seeing flashing lights, pain just below the ribs, and sudden increase in swelling of the hands, face or feet. There are several signs that labor might be starting. These may be different for different women. Find out what labor signs to look out for and when to call your midwife. Your baby at 40 weeks. The fine hair, lanugo, that covered your baby's body is now almost all gone, although some babies may have small patches of it when they're born. You at 40 weeks. Pregnancy normally lasts about 40 weeks, that's around 280 days from the first day of your last period. Most women go into labor a week either side of this date, but some women go overdue. You may be offered an induction of labor, it's your choice whether to have this or not. Your baby at 41 weeks. Because of the hormones in your body, the baby's genitals may look swollen when she or he is born, but they'll soon settle down to their normal size. You at 41 weeks. If you've had a baby before, you'll be offered a membrane sweep at your 41-week appointment. A membrane sweep involves having a vaginal, internal, examination that stimulates the cervix, neck of your womb, to produce hormones that may trigger natural labor. You do not have to have this, you can discuss it with your midwife. You at 42 weeks. Most women go into labor naturally by the time they're 42 weeks pregnant. If your pregnancy lasts longer than 42 weeks and you decide not to have your labor induced, you should be offered increased monitoring to check your baby's well-being. There's a higher risk of stillbirth if you go over 42 weeks pregnant, although most babies remain healthy. At the moment, there's no way to reliably predict which babies are at increased risk of stillbirth, so induction is offered to all women who don't go into labor by 42 weeks. Having induction of labor after the date your baby is due doesn't increase the chance of having a cesarean section. There's actually some evidence it may slightly reduce the chance of having a cesarean section.